hospital, which specializes in cancer treatment. Currently, he served as a senior consultant in oncoplastic, microvascular, and reconstructive surgery at Acharya Sushruta Hospital in India. Dr. Sachin, please start your presentation.
こんばんは and greetings from India to all of you.
I think,
Can you see my screen?
yes, there is a dark spot on your
Uh,
presentation. In the
okay.
middle of the white area, there is dark
Now is it
square.
still there?
Yes, there is.
Oh, I don't know why.
Okay.
Shall I?
Can you proceed your
Yeah, I'll proceed with
presentation?
that. What is that?
We
I will
see.
proceed and
Yeah.
see. Okay.
Okay.
Konbawa, and thank you very much, Kushma Kansel, and the organizer of this talk to give me a chance to speak on my take on Japanese masters. So here I start. Whenever there is a flow of learning from some teacher, we have this mantra in our culture. So let me start with this mantra. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryam Karva Vahai Tejasvina Vaditamastu Ma Vidvishavahai Om Shanti Shanti Shanti. The meaning is together, teacher and student may we move ahead. Together we relish what we are learning, and together we perform for the society. May there never be a discord between the teacher and student, and we shine brilliantly the knowledge to all the society. And the three Shantis means the peace within me, the peace outside me in the world, and the peace in the universe which I am not able to see. With that, let me start my disclaimer. This presentation is my journey into the super microsurgery world. Hope it benefits the audience, though maybe partially, and it might help them to take a journey to learn from the parts of the world where the masters are ready to teach. I haven't included some of my mentors, but it was unintentional. All images are subject to copyright, but I have taken permission from the authors. My quest to learn reconstruction started way back in 2004 when I entered in general surgery practice. Professor C. Gopalakrishnan, the very well-known endocrine surgeons from South India, daily we used to have 3 to 4 thyroid surgeries. And my next professor, S. Vaidyanathan, he was lovingly called as Venus surgeon. The first time ever I could peep into the veins is because of Professor S. Vaidyanathan. He used to repair the valves into the vein. So this was my journey, which continued into reconstruction with plastic surgery, where I met Professor U.R. Nandakumar. He has established the microsurgery unit in entire Kerala, which is a part of South India. And he had 8 jewels, means 8 students who took microsurgery and established microsurgery centers all over South India. Then Professor Subramaniam Iyer, my mentor in plastic surgery, who is very well known for the hand transplants, the leading plastic surgeon in the world now. He has 33 hand transplants to his name. So, to remember my mentors before I start my talk about Japanese masters, I had 8 years of practice before I really met someone in Japan. I did cosmetic, so did the injuries, and I used to get contractures and cancer surgeries. So I had a variety of surgeries in my practice. But some questions arise when I used to see congenital patients, especially the microtia, where you require three-dimensional structure to be made. So how to make this three-dimensional structure from a two-dimensional tissues which we have? And I never get the best results with whatever I knew. So the search began. And this led me to meet Professor Nagata at Saitama, Tokyo. And I observed him very keenly for 3 weeks. What I learned from him, he always planned meticulously. He almost took 1 hour for marking. And he used to make the exact framework from the ribs, which will have millimeter to millimeter match. The special techniques, what I saw was use of the sutures, which we never saw before in our practice. The sutures are basically stainless steel wires and a specific way to suture the ear. So the framework is very solid and a flawless way of taking sutures. Even if there is a difference of between two sutures of a millimeter or so, he will not hesitate to take it again. That was his technique. And he will never leave the dressing to anyone. He will do the dressing himself. These were the surgical skills which I learned. Also, I observed him in the non-surgical skills like how he documented his each case. He would change the gloves and document each stage. The teamwork was very efficient. As soon as the surgery is over, they make the entire theater clean within 3 minutes. Only three people working, and the theater is clean within 3 minutes. That efficiency they had. And Professor Nagata used to immediately put all the surgeries in the block. You can visit his blog. Even today, it is still working. The same day, he will put it on the blocks. And he was an artist by himself. One of his photographs, the paintings, which depicts the entire stages of microtia. This is your own handwork. And whenever I asked him, how did you learn this technique, which is so unique in the world? He explained you should have an artistic view as a surgeon. That's what his techniques I learned. But there was a huge setback for me because as I came back, I could not do a single case because of lack of instruments, maybe because of lack of the ideal patients. And we have a lot of subspecialties which deal with ear reconstruction. So all this gave me a huge setback because I could not perform what I learned from the great master. But this doesn't stop because once I entered in the practice of oncosurgery, then I had to search because this trio of dynamic oncosurgeons which I work with, Dr. Sarvana, Dr. Dipti, and Aruna, all of them pushed my reconstructive limit and they asked me to learn lymphedema, which is out of the realm of my microsurgery on that time. So I searched on net how to how to go and whom you should meet. So this was my search. When I searched lymphedema of upper limb, you can see many papers arise, but one paper when I one few authors were highlighted. Like here, you can see Isao Oshima was the first 450 publication, then Takumi Yamamoto. I tried first to meet Sir, but we could not. With 449 publications and over 1,000 contributions, I met his student first, that is Takumi Yamamoto, where I was planned this visit better. I was 30 days in Tokyo and I learned all the articles beforehand. I performed few surgeries and I understood what I have to see and see when I meet the master the second time. So what I learned how to map the lymphatics, not just the vein, but also the lymphatics through USG, ultrasonography. Selection of cases depends upon the degree or the severity of the disease. And especially there are MAP, LVA or different kind of techniques which you have to do in the specific cases. And first time I saw the treatment of genital lymphodemas where he described triple R. So many things I learned and the concept of micro, super micro, which is less than 0.5 millimeter diameter of vessels, anastomosis. Then I started my own surgeries after coming back from Tokyo, and I started communicating with Takumi and Dr. Reiko, where I mentioned that how I did my few first surgeries. To their surprise, and to my surprise, they sent the little master, Dr. Reko, to our country, India, to collaborate with us. We together operated on many cases in her visit to India, and we innovated a few things like this retractor, which is what we didn't have, what retractor we used to have in Tokyo, but with the help of the little master Reko, we innovated things as it came. This is Reko
This
teaching
is
us
the marking
how to
of
do ultrasound
lateral
therapy.
thoracic perforator. Mm. Mm. Mm.
Right.
Okay. Okay.
And this is how she did the smallest vessel anastomosis. And she will never give up until she is confident that this is the lymphatics and this is the particular size vein and to anastomos.
Oh, wait.
Yeah.
So,
Yes.
try to continue with the larger
Yes, it is larger.
thick.
So I saw and I learned from her to be innovative and communicate very well.
Yes, yes, yes.
She was communicating through Google Translate.
腫れ始めたのはいつですか？
So with that, we also had the first Indo-Japanese conference on lymphedema, where we highlighted the highlight of the conference was only treatment of lymphedema, which is super microsurgery, and we got involved oncologists, oncosurgeons, plastic surgeons, and nursing perspective. Worldwide, it was attended by 100 participants, and in this, I connected through Reiko to Professor Koshima, and that was the basis for my third visit to Professor Koshima. Professor Koshima did not be introduced. He is a pioneer in many of the innovations which has happened in plastic surgery. He has 4 decades of experience, and he's still practicing in his own hospital in Hiroshima, Hiramatsu Hospital. I got hands-on fellowship and trained under him, but to get the hands-on fellowship, I had to do 6 months of planning, and we have to get the certificate of eligibility, which is very important before you land in the country. Daily, we had lymphedema surgeries, and we had morning conferences, which helped me to clear my doubts. Whenever I have a doubt, I could clear in the morning conferences with him. Master was as happy and as lively in the theater as he was in off the theater. To anyone who wants to know about this Master of Masters, you can go through this one of the PDF, which is published by Elena Akileni from, I think from, she's from US. She has given entire how many innovation Master has done. So now coming to what I learned from him. First, the surgical skills, using the right instrument. So I thought whenever we do surgery of that level, he will have some specific instruments. And to my surprise, he said use chopsticks. So I was surprised, but then I understood when you use some final use like chopsticks, you practice the tactile sensation and the neurological development from the fingers to the brain. This is what he explained me. The real instrument is yourself, not the instruments which we see. But still, I understood what is super micro. Was it just a technique or an instrument based or just a name? He explained me that the super micro means this is 10-0 and this is 12-0. Anything below 50 micron is super micro and anything below 30 micron is nanomicron. You can see the needle here. And for the first time in the history of mankind, I saw what is nanomicro with nanotubules. We got a chance to work with him and in the lab where he was demonstrating how to take the sutures in the nanotubes with 13-0. And the technique which he wants us to learn is one hand technique. This is his video where he is doing the 13 micron needle. Let me remind you, as the instruments and the needle become smaller, your little shape, even a millimeter shape, is going to be magnified under the microscope. So this is the one hand technique. This is the most important technique which I learned from Professor Koshima. Coming to the mapping of the lymphatics, because gone are the days when we rely on radiologists give a report. All surgeons and those who wish to do super micro has to learn this technique, that is ultrasonography. This is how he used to map. Before the surgery, within 10 minutes, he will map 10 to 15 sites of the LVA. And the most important and most efficient for our Indian continent, subcontinent, is doing surgery under local anesthesia. So I learned this and practiced it. This is
Start.
one of the dialogues between me and him during the morning
Sir,
conference.
Good morning.
before I start, I will just show the last case, which capillary flap. This was the surgery, and this is after 3 days, and this is after 7 days.
Yeah, okay. Yeah.
And still in follow. And today's disclaimer is, sir, this woman, who is a 45 years old, with, she's a shepherd. This is the markings. You can see the left arm 10 centimeter, forearm 9 centimeter, and distally 5 centimeter. International standard, I grade it as stage 3 lymphedema. And I suggested her multiple LVAs followed by physiotherapy. Self, and she is not covered. We are talking to her in the entire procedure. And given this is how it looks, the arm. And I also try to do a Doppler so that I know, I can't see the lymphatics, but at least I know where are the veins. Where are the small perforators. So I don't know what I would have done. Nicely, I took it proximally. First suture always for me difficult. Staff is trying to help from there. She's also a trained surgeon.
And this daily discussion between Koshima Sensei and
You can see lumen or lymph channel.
Yes, sir. Yes, sir. It will be seen. Little confidence comes in. I remove this. I close this here.
So this is how I carried on what I learned from him. And I used to have discussions daily, almost daily with him online. So Sensei always believes the future lies online. There is no need of really physically going for conferences anymore. With the AI and the tools which we have, even the today's lecture is online. And if one is willing, then he can learn it with a long distance. What I also learned from Sensei is the surgeon's philosophy. So the patient is always right. Listen to him carefully. Even the youngest of young patient, sir will listen to it very carefully. He will give his time and he will see that the patient goes happy. I have never seen any patient who entered into his clinic have left without a smile as this one. Then the teaching is not just a skill, it is an art. These are the undergraduate students who came to him. They were coming in batches. Each student was explained in details about super microsurgery. He never failed in his enthusiasm. He always explained as if each one of them is going to take super microsurgery in the post graduation and in career. And most importantly, a surgeon should keep himself active and fit physically too. Sensei practices his sword surgeries, the sword techniques, katakana, and his nunchaku techniques every day at morning 4 o'clock. And that's how he keeps himself very fit. The future of Indo-Japanese collaboration would be because we have a 10 times more population than Japan, and we have so many requirements for lymphedema surgeons in India. So there was visit from Japanese surgeons like here Hiro Hiramatsu, the director of Hiramatsu Hospital, and Masato Morozumi, both visited India. And we had a CME and workshop by them. And also they showed us the Japanese technique of surgeons by to our people here. We have online weekly webinars. I urge all of the would-be surgeons and the surgeons already to join this crazy group of surgeons where we meet and discuss crazy ideas from Koshima Sensei. And once we make this every Saturday, so please try to visit us and listen to Sensei. I started this Koshima Center in Bangalore very recently, and both the professors visited here. And you can see it's a 24-bedded hospital with I requested Koshima sir to give me his name so that I have a Koshima International Center. Similarly, those who have visited him have started in different places like Coimbatore, Mumbai, and even China. And I see the vision of Professor Koshima that the world requires many surgeons, many super microsurgeons. We started with few, but all these dots will be definitely getting super microsurgeons from Professor Koshima, and we can see many Koshima centers all over the world. So coming to the last few slides where I feel the collaboration should be in both ways. Like it was Buddhism which entered China called as Chan, and then from there it entered Japan, which was known as Zen. From there we take it back in the surgical way from philosophy to technology. And what I learned collectively, I sum up in this slide. The documentation and analysis of your own work is very important. The super surgical skills will be honed by a surgeon with regular practice. Planning and execution of what he has learned is important. And the future of microsurgery is in super microsurgery. And AI would be one of the basis and advancement which all of us has to know. Domo arigatou gozaimasu. Dhanyavad.
陳先生、ありがとうございました。後半のパネルディスカッションは本日ご参加くださっているドクターから募集したいと思います。パネルディスカッションに参加を希望される方は、Zoom 画面にある手のアイコンをクリックしてお知らせください。パネリストに設定をさせていただきます。ふるって手を挙げてください。For the panel discussion from now, we would like to invite doctors from today's audience. If you'd like to join the discussion as a panelist, please click the raise hand icon on your Zoom screen to let us know. We will then set you as a panelist. We warmly encourage you to raise your hand and join us. はい。皆様からのご質問をいただく間に、鴻島先生からご発言をいただきたいと思います。As we gather questions from the audience, we would like to ask Dr. Koshima for his comments on Dr. Sachin's presentation.
Yeah, it's amazing lecture. Yeah, Sachin, I believe you are will become top runner of the world super micro and also microsurgery. You probably your power may be the greatest in the world, and control the microsurgery, world microsurgery in future. So you have not only technique but political power and also your strategy to proceed the reconstructive micro is greatest. So far no one contribute like you. So your task is very important from now. You are young, also middle 40s. So everybody will follow you. Not only India. India always you are controlling and also educating young generation. Not only India, probably your strategy, also politics, also technique will probably contribute all over the world micro. You will become a big hero from now. You are a very, very rare person. Historically, very, very rare person. So also your attitude to learn a new technique, not only technique but policy, and run many famous great teachers all over the world, especially Nagata. Nagata, 2 or 3 years ago, he died with a cardiac infarction, age of 70. So everybody are crying because he was proceeding his own attitude alone, and many foreign doctors learned under him, and he always go to foreign country and teach many outstanding top runner of microsia. So that's why nowadays many foreign specialists microsia and now teaching the young generation. Unfortunately, in Japan, there are not so many students under him. This is the some disadvantage in Japan. Japan is a little bit conservative country. That's why culture is a little different from India and also other countries. So that's why I want to educate through this online system. Main purpose of this online consortium is educate and also Japanese young generation internationally, and want to educate Indian policy to run even in the polling internationally. So this is the most important point. Sorry, so it become a little bit long comment. Because amazed your attitude and also everything. Thank you very much.
Thank you, Sensei,
Thank you,
for
Dr.
such a nice
Kishan.
comments. Thank you very much.
We have Dr. Kishan Kumar.